I don't think that practically and functionally we have connected the social determinants of health with our attempts to maintain and improve health, certainly in our country, where we spend almost $2.5 trillion a year in our health system. That's almost $7,600 per person, per capita. A lot of people don't get much of that. But something is missing because it's not improving health. It leaves out almost 50 million people in our case. And for those who have coverage, many of them don't have access. So having insurance and having access to health care is two different things in our country. So the only question here is, how can we invest more in areas that we know have such an impact on how healthy people are going to be, especially how can we invest more in our children? That's why I keep coming back to we need to invest in our children more in terms of their health and their skills and their capacity to deal. And so in that sense, I think it may well be that people will say, well, we knew that already. Sometimes you have to remind people things in order to get us to move forward. And we certainly have not moved forward in implementing programs to respond to the social determinants of health, at least not in our country. I think I mentioned yesterday, in some states, people are beginning to say, well, if you look at the number of children who are failing coming out of elementary school, you can project how many prison cells you're going to need. I think that's stooping pretty low when we can also project how many more teachers we ought to be producing and how many more classrooms. So I think that's what we're trying to do. That's why we're having this whole discussion, because we haven't made that step forward in terms of applying what we know about social determinants of health.
I think David's fundamentally right. I think that there kind of is a common sense view, particularly if you've been a health worker working at the coalface in underprivileged or underserved populations. You know, it's fairly obvious that poverty actually has an impact on health. But I think that that's kind of not the group of people who need to be convinced. It's really, I think there are some broad reasons why we've failed to make the connection in terms of policy around the social determinants of health and health outcomes. One is because we have a dominance in public policy of economic values, and economic values that privilege things like economic growth, but don't actually look at the ways in which economies produce social inequalities and how social inequalities then drive out gradients in health. So I think that there's a much needed sort of discussion with the economists and the public policy makers who actually are involved in some of the fundamental drivers of economies. I think there's also sometimes a naive assumption that because we know what's responsible for the production of health inequalities or poor health, that translates into knowing what we need to do. We know that poverty and across globally is well established as a fundamental determinant of poor health. Yet the question is, what sorts of economic development are actually going to change that? And we don't know that answer. Or we do know that there's some forms of economic development that make things worse. Yeah. So I think there is a need for us to actually understand better, not the production of health, but how we intervene and actually get a better sense of how you build programs that address the social determinants of health to actually improve health outcomes. To say it another way, there's a strong association with housing and health outcomes. What sorts of housing programs are actually also going to produce health outcomes? We know some of the answers to that, but not all the answers. I think the other reason why this is a really difficult issue, and this comes back to how societies and governments work, is that we've paid a lot of lip service to this issue over the last 20 or 30 years, and we've talked about the need to work across health sectors and non-health sectors, but we don't know how to do it. The kind of structures of government work well in program silos. So the question for me is that how do I convince colleagues in education about looking at the health values in their educational program development? How do I get to my colleagues in Treasury and to start to think about, well, okay, what sorts of economic programs, what are the health outcomes? So it's not, and I don't think we've actually figured out the answer to this question, is how do you work more effectively across government and across what we call the silos?
And that question exists at the global level, because now that this report has gone to WHO, how does it affect the role of WHO? I mean, once you define, the social determinants approach, what does that say about how WHO is going to work with the World Bank and who's going to do what? So I think you're absolutely right. We haven't quite figured that out yet. One way of looking at WHO for the future, of course, is to say that WHO will have a major role for monitoring, the health outcome of all of these changes if they take place, for sort of helping to develop the movement toward those changes and then monitoring what happens when you make changes, evaluating what happens. That's one way to look at the role of WHO, but the fact of the matter is we haven't defined what happens to the role of WHO once we take a social determinant approach.
And I think on a positive end too, there is a growing understanding of a need for a more ecological framework to looking at social issues. We're globally now starting to recognise the broader issues of global climate change. That's bringing us to some fairly fundamental questions about what matters in public policy. So I think that there's a growing recognition of the need to try and figure out the mechanics better of these processes, but I'm not sure that we're quite there yet, and I think we've got a long way to go. So it is an issue, even though for a lot of healthcare workers it's been pretty obvious for a long time that if you want to improve health outcomes, kids need to get to school, they need education, they need employment, they need to not live in poverty, but what you do about that is a big question. I think there was a common theme, because David was talking about the failure of an appropriate response to Hurricane Katrina, and I was talking in a sense about the problem of framing issues in Indigenous child welfare and the incredibly important problems of Aboriginal child abuse and sexual abuse as a crisis inappropriately. And in fact, in our case, it was referred to as our Hurricane Katrina. And even though I think I certainly feel there was a need to galvanise urgent action, I think one of the problems of a crisis framework in this context is that these are issues that are complex, that require addressing in multiple determinants of child welfare, and they require working an approach that works with communities and families, producing leadership to address the issues locally as well as jurisdictionally and nationally. And the unfortunate outcome of a crisis framework is that it led to a very top-down paternalistic approach, which probably ultimately has some significant consequences for health. I think fortunately in this case it was also linked to some longer-term investment in basic services and interventions, but I think ultimately that crisis framework tended to obscure the need to actually address some of the issues like poverty and education.
Well, and I think part of what I was trying to say by dividing this look at social determinants into before, during, and after